Okay, everyone, we are pleased to say that Suzanne Boccia is on the line and ready to discuss the COVID vaccine distribution. Good morning, Suzanne. Well, let's see here. Now what? Hang on just a minute, folks. We'll be back with Suzanne, I promise. Hello, Suzanne. Are you there?
I am. Can you hear me okay?
There's something going on with our equipment, and I'm going to have to talk to our engineer every week now. I've got to reset that thing. So my apologies for the delay, but welcome to the show. We're glad to have you back.
Thank you. I'm glad to be here.
All right. Well, let's get down to it. I just heard Dr. Ryan, or maybe it was you, on the COVID update, say there are no new vaccines for this week. I wonder if the people who are expecting their second doses are there doses for those folks, or maybe any information you could give me?
Yeah, that's a great question. We have planned, and we plan every day, all day, to make sure that we have those vaccines, to make sure that we provide them for the second doses. So we do have that for this week. Anyone that is needing a second dose this week, they have been or in the process of being scheduled for Wednesday, and we're also able to ensure that we have that for next week. So we're working closely with the state, and while there are variations on how many first doses we might receive each week, the state has told us they will absolutely provide us with enough for second doses on any week that we need them. So those are one of the variables that we continue to plan with our state partners.
Well, that's great to hear, because when I heard that discussion on the air, I thought, oh boy, that could cause confusion for folks. And I think it's important to stress that it's not just this week, but for all weeks going forward. That's if you are expecting your second dose and you have been told a certain date, then you can rely upon that information. And if you're scheduled, just come on down at your scheduled time, right?
Yes, that's correct. And we do want to thank everyone that we have seen in our vaccination site so far. There are folks that do come a little bit early, and we do encourage you to continue to stay with your vaccination times. And the reason is we don't want to have a long backup and a long wait time for folks. That's part of the reason why one of the reasons why we schedule folks so specifically is, one, to make sure that we do not waste one dose of the vaccine, because as you know, when you open a vial, there are 10 or 11 doses in each vial, depending on many, many factors. One of them is the type of needles that are used, but, we do not want to open a vial towards the end of the day and not have the people to give it to. So that is one of the reasons that we schedule folks so specifically. Another is we have been testing in our 2 drive-through vaccination sites that we've had so far, which we believe and we have heard from folks, they've been quite successful as far as being organized and efficient. There are a few snafus here and there, but overall, it's run very smoothly. One of the reasons that we schedule folks so specifically is to make sure that we don't have folks waiting for a long period of time. It's really cold out. People are coming in their cars, but we don't want people to be waiting for a long period of time. So we want to be able to get people through efficiently. So that's why we really ask that you stick to your appointment time as much as possible, unless you get a phone call from us that says, go ahead, you can come in earlier. Because we have done that for a few folks because as the day goes on, we realize we can be even more efficient, and so we ask people if they're available to come on in a little early. But please don't do that unless we give you a call. We appreciate that.
Okay, so everyone is assigned a certain time to show up, and please stay with that time unless you hear otherwise. Okay, now I want you to walk folks through the actual process, okay? Let's imagine that, for instance, I was coming to the site in Dumont, that big tin building, I call it the Brown Palace. I spent hundreds and hundreds of nights sleeping there when I worked on the ambulance, and it's quite a facility, but nevertheless, that's where the shots are being administered. So can you please do that? Walk us through, let's say my appointment time was 8 o'clock tomorrow morning. What could I expect?
Sure. Absolutely. Would love to. So when you drive up to, as you call it, the Brown Palace, the EMS site in Dumont that we provide that information via our online scheduling system, you drive up, and we have worked to put more signage up. One of the lessons that we learned from our first vaccination site that we addressed last week was we need a little bit more signage, and so we have put some of that signage up, and we have individuals right out front to guide people in. So essentially, people drive up, and someone will ask them if they have an appointment, and if they have an appointment, they will continue to drive around to the side of the EMS building. There we have greeters that ask them again if they have an appointment and if they have brought their completed screening form. That's that one-page document with your name, some basic information that's required from the state and the federal government when any vaccines are given. It also asks you a few questions. Have you had any sort of reactions to past vaccines of any types? Do you have any allergies? And that's to make sure that that our EMS and our nurses that are on scene, if there are any of those potential adverse reactions, that they know about that. That's the reason those are asked. So then if you have your form with you, there's, I guess you could call it an express lane. We have a couple of lanes. So the greeter will, let you know which lane to drive through. And essentially you drive up to the next station. It's, a few yards. And then a screener, someone with medical background, either EMS or a public health nurse, will look at your form, ask you a couple of questions. Again, it's just looking at what the form says, ask you if you have any questions, and you keep your form with you, and then you drive up to the next station, if you will. Again, it's a few yards ahead, and there are people standing there, and they will, tell you when to stop. And then either an EMS or a nurse, public health nurse, will come to your car and make sure that they they confirm who you are, so that they make sure that they have the proper form for you. They will tell you that they're going to give you your shot, and then they give you your shot in your arm. We appreciate if people can remain in their vehicles, although we understand if people have to step out, if they have a bulky jacket or something like that. That's fine. We accommodate that. And then the folks giving the shot provide the person that received the shot with their white CDC colored vaccination card, and they provide the date that vaccine was given. And then what they do is they say we either recommend that you are observed for 15 or 30 minutes, depending on what you put in your screening form. And what that means is you drive across the street to a parking lot where our EMS folks greet you, and our EMS folks are there on scene to monitor you for 15 or 30 minutes. What that means is you sit in your car for 15 or 30 minutes, mostly 15 minutes, just to see if there's any sort of immediate reaction to this vaccine. And that is the process. And you time yourself, and when your 15 or 30 minutes are up, you can drive on home or to whatever else you're doing in the day.
Have you had any allergic reactions to date? And without being too explicit, can you talk to any severity that you might have encountered?
Sure, I will do that. Knowing that I am a emergency management professional, I am not a health professional, so when you talk with Dr. Ryan, he can provide more information if you'd like. But generally, we have seen very few And I will caveat that to say during the first doses, what we have received reports of is that people were tired, their arm was sore, things that you have heard that are happening, nationwide. Arm is sore, a bit tired, perhaps running a slight fever for maybe 24 hours. That is the same thing that happened to me. I didn't have a fever, but I was pretty tired. My arm was sore. I get a flu shot every year, and my arm has never been sore, and I've never had any sort of tired reaction from it. But I got this, the first dose of my vaccination. I was a little bit tired for a day, and that is to be expected or anticipated, so we encourage people to not be surprised if that happens. What we have been hearing about for the second dose is that some people may be even more tired, and that happened to me. I was a little more tired for a little longer period of time, 2 or 3 days. For me, it wasn't debilitating. It was just I realized I needed to rest a little bit more. But what we have heard is that some people are experiencing a rash. Some people are experiencing a slight fever that might last a little bit longer and increased tiredness. Again, those are generally considered by the medical community mild reactions. Some people may have more than that, and so that is one of the reasons that those initial screening questions are asked on that form. And so what we have done recently in the past few days is to update our public information on our website and via social media to let people know that while we have heard that there are a few more reactions to the second dose, they're still generally considered mild, but don't be surprised if you're a little more tired or get a slight fever when you receive your second dose.
Yeah, and the reaction that you might have is your body's immune system kicking into gear. And so that's not a bad thing as long as it's not some severe allergic reaction. And that's why you're asked to wait 15 or 30 minutes on site. So if you were to have some more severe reaction, then the paramedics are there to administer to you. Yeah, okay. Well, that doesn't sound too bad. I know that there's been about maybe 20 million people vaccinated across the country, and nobody has died from it, from the vaccination. In the meantime, another 100,000 or more people have died from COVID. So when you balance those statistics, it seems like a small price to pay for the protection that is provided to you. Now, Suzanne, I know that that week to week there is a variety of the amount of vaccines that are made available to the county. How do you adjust your personnel for that? Is that I know the county nurses that's a finite number. I believe there's 3. But there's quite a few paramedics within the EMS and fire department. Is that the resource that you fall back to?
Yes, that is a great question. Happy to talk about how we staff our vaccination sites. So yes, you're correct. We do have 3 public health nurses, Crystal, Andrea, and Emily, and they're amazing, and they are at every one of our vaccination sites. In addition to that, we have got quite a few EMS folks. Last week we had, I believe it was 13 staffing the vaccination site. And within the vaccination site, we have a number of different folks. You heard me earlier explain, we've got the people that manage the traffic, both incoming and exiting the actual site for your shots, and then across the street at the observation area. We have people that are greeters. We have people that are medically trained screeners and shot givers. But if you've been to the site at EMS, outside we have a inflatable tent. And that's where our folks are doing some data entry and making sure that we are monitoring how many vaccines we've got, how many vaccines we're giving, if we have any no-shows. We really have had very, very few no-shows, and those that have, we have been able to contact them and ask them why. So something else I do want to emphasize, we have not received very many, I think it was one question or concern about being able to have transportation to the site. one person's transportation happened to fall through that day. So we do want to encourage anyone that if they have any impediments to getting to the vaccination site on their day of the of their appointment, you can go ahead and call the number that is provided in your appointment email. You can call our COVID health line and let someone know. If you have a friend that can bring you, great. If that is an impediment to you getting to someone getting to the scene, we have alternate plans in place. But yes, we have, a dozen. EMS has been absolutely amazing in being organizing our vaccination sites. They have been a key partner in administering our testing sites from the beginning, from last May. They have been on scene administering testing and now administering vaccines, being there for the observation site. So, they have been absolutely incredible. They are a key partner, and this couldn't be done without EMS. So, we have a really great team within Clear Creek County, and we're all working together to get this done.
Well, it sounds great, and I know I want to emphasize to folks it is free. All of that service comes to you through your tax dollars, and so don't be afraid to sign up because you might think there might be a cost. There's no cost whatsoever. Something else that occurred to me as you were speaking about the administration of the vaccine, you said that occasionally they were able to squeeze an additional dose out of a vial. So that means that you could, and then a few people might cancel their appointments. So that means that you're going to have some extra doses at the end of the day. How are you dealing with that?
Yeah, that's a great question. For each site that we have conducted so far, and the same with what we're doing this week, we have essentially a backup list. So our Public Health Emergency Preparedness Coordinator, Olivia Watson, many of you, I'm sure, have heard from her either via phone calls to get scheduled or emails to get scheduled. She is helping to manage that names of folks that may be available that day if we have extra doses. So last week we had a number of folks that if they came through with someone with an appointment, we had some folks ask, I'm close to the 70-plus age. Can I please get a vaccine today? It is one of the most difficult things to say, unfortunately, I'm sorry, no, we can't. We don't want to say no. However, we have worked really hard to match up the folks that have provided us information that they are interested in getting the vaccine with the number of vaccine doses that we have or may have, with the accommodating the state's phases and intent to get 70 those in our community age 70 and plus vaccinated first throughout the state. So we do not want to say no, but unfortunately we have to sometimes. And yes, we do have a list of names of folks that if we may have extra doses, we look at that later on in our vaccination day, because we want to make sure that whoever has an appointment, we absolutely have those vaccination doses ready for them, and they do not have to worry about whether or not they will have one. And so that is our approach, and we work really, really hard to make sure we have some folks lined up, as well as making sure that everyone that comes in that has an appointment has a vaccine dose, and we have been successful so far in that.
Suzanne, I want to touch on one small point. Mm-hmm. When I said that sometimes they can squeeze an extra dose out of a vial, I feel as though I want to throw some information out there. As a retired paramedic myself, I would say that it's very routine to find that a vial that is supposed to have X amount of fluid in it will invariably have a small amount of extra. And so if you are diligent in pulling your dose from a vial, you can probably find some extra in there. I say this because I don't want people to think that, they're shorting everybody a little bit on their dose so they can squeeze another one out of there. That's not how that works.
No, that's a great clarification. Thank you for saying that. It's not that at all. You are right. I'm not a medical professional. What our EMS folks and our medical folks that draw the doses, so they fill the needles out of the syringes, they have a very calm and deliberative method for doing that, and they depending on exactly how much is in that vial. And also what they have let us know is depending on which needle is used. We get certain needles from the state. We have certain needles that we have purchased to make sure that we're never at a lack for any syringes to draw the doses. So depending on a number of factors, yes, there is some variability in how many doses can be drawn from a vial. And, what our EMS folks have let me know, I'll say, as a layperson, is that is very common. It's not specific to COVID vaccinations. And you had just mentioned that, and based on your experience, that's what you know. So those are one of the variables that we do manage at our vaccination site very closely. We talk continuously throughout the day. Do we have any extra doses? How many might we have? And that is how we figure out if we have any extra doses. And if we do, then we start contacting folks that may be available that day to receive their dose.
Okay, Suzanne, I just want to I want to add my voice to those that I know you've already heard. The people that I've spoken to have gone through your process. They are just so pleased with the efficiency, the courtesy, the care with which everyone has acted within the system, and it's obviously there's been a lot of thought put into just exactly the best way to do this, and I don't know, maybe some people have been dissatisfied with the process, but the many folks that I've spoken to in my community who have gone through the process have all universally praised their experience. So congratulations, keep up the good work, and I know that we'll get through this thing. It's so disappointing to hear that we didn't receive any initial vaccine doses this week, and hopefully this process of production and distribution will accelerate in the weeks to come, and we'll be able to get after it. And soon we'll have 20, 30% of the population instead of 5% vaccinated.
Yeah, it is a little disappointing, but it's not altogether unexpected. I mean, if you look at the population in the United States and you look at the number of vaccines that are able to be manufactured and distributed, it's not altogether unsurprising that there's not enough supply for the demand. And so, we are working, at a county level, at the state level, every week to see what we receive from the federal government and then distribute it as equitably as possible. And so we really appreciate, Mark, you sharing that information about people experiencing a efficient and friendly process. That's absolutely what we are going for, efficient, friendly, easy. And we know in the beginning we were telling people to be patient. We continue to tell people to be patient. So we want to thank everyone for being patient with this process as we figure it out, but also, providing that feedback to us, because we'd like to hear, yes, there are going to be bumps. There are going to be things that we could probably do better. And at the end of every day at our vaccination site, we get together for a very brief, what we call a hot wash, very briefly say, hey, what went well today and what can we make better for next time? And we implement those things immediately. And so we are doing that every single week. And I just want to emphasize, the way that we're able to do this, plan for these sites is a partnership through everyone throughout our county. But, the way that this has come to pass is, we have grant dollars from our federal government for public health emergency preparedness, for emergency management, for EMS and for public health overall. And, to be able to do those, these are planning efforts. This is something that we had plans for something like this in place. Clearly, these plans had to be adapted to fit 2 rounds of shots and to accommodate our cold weather and accommodate how many people we need to staff a vaccination site. But so these are things that we do behind the scenes, and that what every county in the state and the country has been doing for many, many years to plan for something like this, but clearly not exactly like this. But we are really proud that we're able to adapt and be flexible with our plans and implement them to be able to serve those within Clear Creek County and our partners.
Well, when you put planning infrastructure in place, and if it's solid and well thought through, then the details of how you implement that are easy to manipulate. And obviously, there's been a lot of good work put into this. And I'm glad that you mentioned the support that the county has gotten from the federal government, and I'm sure the state government also. But on the ground here in the county, that's where the rubber hits the road, and you guys have done a great job. And I want to thank you personally and from all of the folks that I've spoken to as well.
Well, thank you. We really appreciate that, and we definitely appreciate the support. It's a lot of hard work, but we are very, very happy to be able to, conduct these vaccination sites for our community, and we are happy to do that and to continue to do that as long as we need to get everyone the vaccination that wants it. So thank you.
Well, Suzanne, thanks for joining the show again today. I know you're very busy, and I look forward to having you on the show again sometime in the near future, and hopefully we'll have some better news about the number of vaccinations available to folks. And until then, thanks again.
All right. Thank you.
Bye.